Namaste. We are back with what happens to us with COVID-19. While it's mild or moderate, there are certain protocols we follow, certain things we can expect. We've seen it already. But what happens when the big word ICU looms ahead? What happens when the scary concept of ventilator comes into play? What happens to us is a question that many of us have. And those questions need to be answered because there is nothing more scary than ignorance, which is why we're here back at Apollo. With us is Dr. Ramakrishnan, who is a senior consultant critical care and sleep medicine, and also he is the director of critical care services here at Apollo Hospitals. On a side note, Dr. Ramakrishnan is also an acclaimed author. On one side, while he gets his patients ready to get out of bed, on the other side, he gets his patients ready to go to bed, which is what has been the crux of his two works, Thookam Prachanagal Thirvugal and also Thookam Un Kangalai Thaluvatuve. Today, however, the most relevant book of his is his first work, ICU Ulle Nadappadu Enna. COVID-19 nama taakina ICU Ulle Nadappadu Enna is what we are going to speak with him about and gain clarity and gain confidence and courage. Namaste, Dr.
Namaste.
Thank you very much for joining us.
Pleasure.
I know we've taken you from your very busy schedule, so we are going to keep this quick and as painless as possible.
Thank you, but it's equally important to get out the real news on what is happening so that people take away all their misconceptions about critical care.
Which is very essential, especially in a pandemic situation like this when most of us don't know what is happening. We are all learning, to be honest. We do not know what is next. We come in here, but what happens when we take a turn for the worst? At what point does it turn severe?
First thing we need to understand is, any viral infection, any bacterial infection, when it affects our system, the body responds to it in different ways. There are some of us who get the infection, it just turns mild and you are doing perfectly fine after a few days of treatment. There are some who for the same infection, whether it is a urinary infection or a pneumonia or any of those, may actually suffer and things can take a turn for the worse. So it is the response or the immune response that determines how each patient behaves. So a same infection can cause different outcomes in different people. It's not just COVID. Anywhere, we should understand that coming to an ICU does not mean that they don't go back home. That is a huge misconception that people have.
It scares one to go to the ICU because you think then you are almost near some finish line which you don't want to be.
Anything that is intensive is scary.
It is.
So it is intensive care unit. The care is intensive.
So it should not scare. It is
exactly.
Scare.
The second thing that you brought up very appropriately about, here is a disease where we don't know what the treatment is and therefore we are all scared. Honestly, for a lot of the viral infections, even before, whether it was the swine flu or whether it was the SARS or any of those, we did not have a treatment when the epidemic started. The reason why, we are scared now is this has become a pandemic because the infectious nature of this is much more significant than most of the other viral illnesses. So the number of people who are getting it simultaneously, the number of people who are requiring intensive care is all multiplied so many times, which is why people are scared about it. When we manage a patient in the ICU, there is the focused or the specific treatment for the disease, but there's a lot of what we call supportive treatment.
So the infection can affect various organs of the body. It doesn't have to affect the same organ for everybody uniformly.
Absolutely. It has a target organ. COVID primarily is a pneumonia. It is a viral pneumonia. So the main organ that is often affected is the lung. Okay. But when it becomes severe, then our body creates what we call an inflammatory response. The body is inflamed, it spreads into the blood, it starts affecting multiple organs, and we call it as multiple organ dysfunction syndrome. Initially it could start off as a lung infection or a pneumonia, but it could affect all our organs, including like people could get confused, which is some form of like what we call brain dysfunction, encephalopathy. It could affect the heart function could be reduced. It could affect the gut, people could start having slowing down of the gut. They may not able to tolerate
Right.
feeds, it could cause kidney dysfunction, it could cause any of these. And the blood pressure dropping in response to the inflammation is primarily responsible for all of these organ damages, because when the blood pressure drops, the blood flow to all the organs reduce, and the two organs that are most sensitive to it are brain and kidney.
Okay. So organs start to slowly shut down. Can I call it that?
If it becomes severe and uncontrollable. But again, I want to specify that everybody doesn't present that way. There are some who just need oxygen support, because as I said, the main organ that's affected is the lung.
I presume what we are talking about are progressions in the ICU.
Absolutely.
Does everybody that comes into the ICU end up on CPAP or ventilator?
Not necessarily.
Okay.
For COVID infections, we either keep them in the isolation ward, which they are not requiring any other additional support. The moment they require oxygen or higher, then I would classify them as at least being monitored in an ICU or an intensive care unit. The reason is, if they start requiring oxygen, they may start requiring more and more, and they need to be closely monitored. So the ICU is for the close monitoring more than even for the therapy, so that we don't delay the treatment for any reason, because the earlier you catch it and treat, the chances of an improved outcome is much more.
Although there is no cure yet.
For most viral infections, there has never been a cure. The good old example is chickenpox. For a long period, we didn't have a cure or an antiviral treatment. But what were we doing? We were quarantining them at home.
We had chickenpox parties, doctor. As mothers, we used to call other children when our child had chickenpox
to develop herd immunity.
Yes, that's what we did with chickenpox.
In fact, the reason that was done was, people thought chickenpox in a child is better than a chickenpox in an adult.
Which could prove fatal?
Which could be very much more severe, because it starts affecting multiple organs. So why I brought up the chickenpox example is, for a lot of viral infections, there have not been treatments immediately. We may be developing, we may develop vaccine, we may have antiviral drugs that are going to work or limit the progression to severity. But until then, we need to provide this supportive treatment, which itself seems to help a lot of people. A lot of people who are sick, who are in the ICU, who are requiring oxygen, do very well and go home. Requiring oxygen or requiring some kind of ventilatory support is not the end. Yes, if it progresses to multiple organ dysfunction, they could succumb to it, but that number is small.
So when somebody comes in to the hospital, they are in isolation, and that flip from moderate to severe happens when they start requiring support for breathing.
Yes.
Which is when you step in and you address how that needs to happen.
Absolutely.
Everybody speaks of comorbidities. Many say that a lot of the deaths are not just due to COVID-19, however, they are due to other conditions, other lacks, other physical problems that these patients are presenting with. How much of that do you see in your ICU?
The commonest comorbidities that we see are diabetes, hypertension, underlying heart disease, people with arthritis, asthma, who have required, medications like steroid in the past, which all suppress their immunity. So these are the people who can develop what we call florid infections, or their inflammation goes unsuppressed, and therefore may experience worsening of the disease. So it's important to identify people who have comorbidities and who are developing this problem, start observing them, monitoring them closely, so that any quick deterioration can be easily picked up and managed.
Let me understand this. So, because there is a pre-existing condition, the severity of a SARS-CoV-2 infection increases. And if expiry occurs, that occurs because of the increase in severity of COVID-19, not of the original condition. Is that what it is?
I'm glad you asked, and I want to clarify once again what I mentioned earlier. It is our body's immunity and our body's ability to fight the infection, which is lower in people with comorbidities because their immunity is low.
So when they say immunity, it's not about drinking ginger and tulsi today, right? For us to build immunity is going to take at least 1 year of healthy eating? If I take copious amounts of ginger today, that does not mean if I'm exposing myself to the virus, I am safe.
I am not a specialist in anything other than allopathic medicine. It is not appropriate for me to comment on, the naturopathy and other kind of medications.
Fair enough.
But as a culture, we've always relied on healthy eating and all of those as a good way to boost our immunity. Good old grandma giving me turmeric in milk whenever I had cold, I probably made fun of it. But today, when international coffee companies sell it as a turmeric latte,
yes,
all of us would go and drink it.
and pay
So,
what, $15 for it?
my feeling is, let's not blow it off, but I do agree it is not going to cause an overnight improvement in your immunity.
I'm not blowing off ginger.
Yes.
I am blowing off this time frame, and I will be straight
Sure.
about it.
Sure, it is not an overnight thing that's going to happen, but it is good for people to have healthy habits to improve your immunity overall in the long run.
To revive our Indianism. Personal immunity is what is going to see us through this. Healthy practices, best practices. Now,
And not delaying the care.
that is when you recognize and move them into the ICU.
People shouldn't hide their symptoms. People shouldn't say, oh, I just have fever, I'm not feeling breathless. They should understand that if at all you do, it is better to go and get monitored, observed sooner than later, because the chances of us helping you to improve is much better when we catch things early.
See, now everybody talks about maintaining personal hygiene and cleanliness to minimize our risk of contracting the virus. Great. Now, in the healthcare sector, all of you work day in and day out with various patients, not only COVID-19 patients. How many times a day do you change your personal protection equipment?
Whenever we have any suspected patient with COVID, we need to wear our personal protective equipment. And a lot of the times we go in, examine the patient, we may have to see multiple patients, we'll have to wear our entire suit when we are going in. You're completely covered.
What all is there in that?
It covers right from, covering your head, your face shield, your mask, just all the way up to your neck needs to be covered. You have a full jumpsuit, which, covers your entire body.
And closes.
Yeah. So literally no part of your body should be exposed, but you should be able to see and you should be able to perform your duties.
Isn't it difficult? Mobility, understanding, tactile sensation, like the smell maybe. How is it?
It is extremely difficult, so I'm not going to lie on that. However, our environment, particularly in a city like Chennai, doesn't make it any easier because it's extremely hot and humid. All our healthcare professionals literally sweat underneath, and what makes it really hard is, let's say there is a nurse who has to take care and they are at the bedside for a long time, they wear the entire jumpsuit, they can't even use the restroom because they have to remove the entire thing, go back and then come back in with an entire suit. So it is not easy by any means. We are very fortunate to have very committed healthcare professionals who are doing this.
We are very fortunate to have very committed healthcare professionals who are doing this.
Thank you. These are times when all of us, whether it is doctors, nurses, anyone, we all have our moments of frustration, we all have our moments of irritability, we all have our moments of burnout. But beyond all that, when we look back at the end of the day, we feel we have done something good and we walk back home with happiness.
Doctor, you haven't just done something good. Every single day that you are out here, many of you have a choice. Many of you are so senior in your profession that you can actually sit back home. How many of you do that? Very few. Most of you are here on the field working for us. And in the face of that, when we disregard protocol, when we flaunt safety, and when we do stupid things, I believe it's a criminal act. And more than anything else, what I am striving to give here is an understanding of what actually happens in the hospital, in the ICU, the efforts that you put in. We hear a lot of stories outside. We hear a lot of sound. When it comes to an ICU, which is why I very specifically asked about PPE in the ICU also, how many times do you end up changing it in a day?